In November of 2023, the Swell Pod took a 10-day journey across 5 states, traveling 3,580 miles with one challenge in mind.
And that challenge was to interview 100 pleasantly rebellious humans to uncover deep truths about what it takes to create something that has never existed before, challenge the status quo, maybe even change the world.
This is the Kiln Road Trip, created and produced by the Swell Pod.
In partnership with Kiln, Moterra Camper Vans, and sponsored by Taurus.
I'm Spencer McKeown.
And I'm Josh Taylor, and together we're the co-hosts of the Swell Pod and your guides on the Kiln Road Trip. Follow along on the journey.
Be sure to subscribe to the podcast, follow the Swell Pod on social media, and subscribe to your YouTube channel at, you guessed it, the Swell Pod.
This is interview 28 of the Kiln Road Trip, and today we're at Kiln Lehi talking with Josilyn Olsen. Josilyn is co-founder and CMO of Modwella, which is short for Modern Wellness. Modwella is an in-home concierge health and wellness service. They connect clients and caregivers in a way that is fulfilling, affordable, and most of all, convenient. Thanks for tuning in. We hope you enjoy. Well, so thank you, Josilyn, for coming and being on the Swell podcast.
Yes, thank you for having me.
Yeah, so I think, we'll just start, if you could just, and I'm sorry, I feel like
it's a giant taco.
I cannot focus, I'm sorry. Can you just introduce yourself and tell us what you do?
Sure. I'm Josilyn. I am the co-founder and CMO of Modwella. We're an in-home health and wellness service. So what we do is we connect clients and caregivers in a way that's fulfilling, affordable, and most of all, convenient.
Yeah, that's amazing. And what started this? Like, what was the impetus that kind of led you down this path?
Well, we have 3 co-founders. So my husband and I, and he's an ER doctor. And then my husband's cousin was a nurse. So as a doctor, a nurse, and a patient in our current healthcare system, we got together, I think, at a crucial, a pivotal time in healthcare where we just knew a change needed to happen. And based on our experiences, this kind of mobile, convenient healthcare was born. We are hoping to bring, we're really hoping to change the face of the healthcare system altogether, but it is no small task.
Right.
So we're starting on, it was a small, kind of in our community, we just wanted to bring mobile IVs to our little community, which was Utah County. And then all of a sudden the idea grew and grew and people were loving it. And now we're in 9 states and I think it's taking hold, but we're starting small. So with mobile IVs, but we hope to expand our services and just make it more accessible for people to get the health care that they need and want.
Yeah, that's amazing. And how long ago did you officially start? So when you were first starting those mobile IVs?
2021.
Okay.
And we started out as a different name. So we've had a name change and we were just mobile IVs and then we've expanded our services since then.
Very cool. And you said, so co-founder and CMO?
Yes.
Cool. Okay. Yeah. Awesome. And so, just, I guess, take us back a little bit, help us understand a little bit more about you and kind of how you got to this point.
So my husband, he did his medical degree through the military. So we're military and medical. And we moved around the country for years. I had babies under the Army's care. And I was realizing I was kind of alone all the time. We were in new communities all the time. And I felt really alone. I didn't know who to turn to, who to trust. And I was having a lot of health issues at the time. My husband was gone. And so I had my own dealings with the medical system. And I wasn't super happy about the patient experience. And so through that, I was like, I just wish it could be more convenient, especially for a mom of young kids. I'm alone. I'm having to strap them all in the car, get them to a provider who I don't know, and half of the time I would go and I wouldn't be diagnosed with anything. So there was no treatment. And I was like, that can't be, we can't leave people feeling so lonely all the time and so crazy, I like to call it, because I left with nothing. And so I was thinking, well, what if all that we need is just some intermediary? What if you had someone come to your home, a nurse? Nurses are the most trusted medical profession in the U.S., especially since COVID. What if you had a nurse come to your home on your level where you didn't have to leave? You could stay in bed if you weren't feeling well. She comes to your bedside. She talks to you. She touches you. And she assesses your situation. Is like, how are you feeling? Are you okay? Well, guess what? I'm going to leave you better than I found you. And sometimes I wonder if that's all that we need is just some more connection. And so through my experience, I was like, what can we do to provide these patients who aren't getting the care that they need more connection, more convenience on their level? And so the mobile aspect was born.
Yeah, that's incredible.
Pretty different.
Yeah, definitely.
Yeah, it's very different. It's very different from the status quo. We are really thinking outside of the box here. And the same on the medical side. My husband has been in medical for so long that he leaves his job feeling probably the same as me, lonely, disconnected. He's checking boxes all day. If you don't fit inside a box, you don't get treated, you don't get diagnosed, and you don't get help from the insurance companies. So we are really just trying to make it a more connected medical system.
Yeah. And what have people been saying? So as you've started locally and kind of grown it to, you said 9 states? Yeah. So what have people been saying?
Well, the backlash is, oh, you're crazy. This stuff is just voodoo. It doesn't work. You're giving people IVs. Vitamins don't work. It's really hard to tell the value of connection.
Yeah.
You know, there are no metrics for it. And vitamins and minerals say that we give people in their IVs. Like, it seems voodoo. But on the flip side, we have hundreds and hundreds of 5-star reviews.
Yeah.
And that's because people really are feeling a difference.
Yeah.
Maybe they're not diagnosed and need to be treated with a typical medication, but they wanted that interaction, and maybe they needed to be hydrated. Maybe they had micronutrient depletions. People are loving it. Yeah. So that's why we keep going.
Yeah. And so what are you continuing to go towards? Like, so the mobile IVs, and you mentioned that you're looking to expand, like, where are you headed?
We are headed probably to a full service mobile medical system, including telehealth, including prescriptions, all the things that you could get at your family provider. We're hoping to bring all those services as well. But on the flip side, we also want to bring services that they don't offer, things like IVs, things that are more preventative. We like to focus a little bit more on prevention and wellness rather than diagnosis and treatment. We'd like to push more education and exercise and all of the health and wellness modalities before you get that full-blown disease.
So the kind of the full holistic view
Yeah,
of the person's health before they're ill, if they're ill,
Yep.
and post.
Yeah.
It's really interesting. This is a totally different example, but we interviewed the Treads guy. Bring your mechanics to your home to fix your car, make it effortless, fix it before it needs fixing, or tires and things. But much more important here, you're talking about the physical body and the everything that goes with someone's mental fitness and they're very good. What type of challenges are you facing? Other than obviously people's perception of what is this thing?
Expectations and perception is huge because we've kind of learned to fit inside boxes. This is so far outside of the box that we have to control expectation and perception for sure. But more than that, what we're dealing with day to day is the mobile aspect and software that is conducive to like a mobile healthcare system. We have found certain modalities that help, certain software that's great for some things, but just doesn't fit us in all aspects. We're closer, but not quite there. So being mobile, we're kind of paving the way in the healthcare system. So we're looking for some good software to help us along the way.
Yeah. Before we get into the rest of the episode, we want to thank the partners and sponsors who made the Kiln Road Trip possible. The Kiln Road Trip is brought to you by Kiln. Kiln is a boutique co-working and flex office community with 13 locations in 6 states across the West, dedicated to providing innovative workspaces that empower your team to thrive. Whether you're a solo visionary or an enterprise-level team of up to 100, Kiln transcends being merely a place to work. It's a hub for learning and connecting with like-minded professionals that will make you and your team love where you work.
And if you haven't stepped foot inside a kiln yet, you really need to. On this road trip, we visited every single location, and trust us when we say once you see these beautifully designed spaces, meet the talented team, and connect with fellow members, you won't want to work anywhere else.
Locations include Utah, Colorado, Idaho, Oregon, California, and Arizona. And they're growing too, with multiple locations set to open in 2024.
Yeah, so be sure to check out the kiln locations nearest you by booking a tour at kiln.com and answer SWELL in the question, how did you hear about us? Once you complete the tour, you'll be entered into a competition where you could win a 1-year membership, their club membership at Kiln.
Yep, you heard that. That's kiln.com, book a tour, and be sure to mention SWELL in the question, how did you hear about us?
The Kiln Road Trip is also brought to you by Modwella Camper Vans, a luxury camper van rental company for iconic road trips. Their top-of-the-line vans are available at 7 locations located near America's best outdoor adventure destinations. They have consistently earned the highest customer ratings in the industry, making Modwella camper vans your gateway to adventure without sacrificing on comfort or service.
That's true, and initially we wanted to take this journey in a 1960s VW bus, but thankfully we found Modwella instead. With 3 van options, we took the Pop Top Classic, which sleeps 4 and is best for those who want to maximize floor space and storage. This was critical for us because it needed to sleep the entire crew, we needed space to edit, and we were traveling with large amounts of equipment, luggage, and other goodies that we picked up along the way.
And this van took us through all 3,580 miles of the trip. Super comfortable and sweet to drive.
And actually, Modwella offers fully planned itineraries if you'd rather leave the planning to someone else.
Visit gomodwella.com/swell. That's gomodwella.com/swell.
This episode is also brought to you by Taurus. Taurus is leading the charge in home energy storage. Taurus makes it easy to achieve energy independence and a greener tomorrow. The Taurus station provides everything you need to generate clean power, efficiently store electricity, and easily manage your energy use.
And installing a Taurus station offers plenty of benefits, including save money on your electricity bill,
also ensure energy security with backup power during outages,
reduce carbon emissions with renewables.
You can also automate EV charging and HVAC systems with 100% renewables.
And enjoy unrivaled system monitoring and support.
If you like the sound of those benefits, get a quote to build your Taurus station in less than 30 seconds. Super easy at taurus.co. That's TORUS.co. Now, let's get back to the episode. Are you building out of Kiln? Is there a connection to Kiln?
Yeah.
Wish
there was.
Well, we love Kiln because they are able to move and expand with us.
Right.
Yeah. It's incredible. As we were looking for a new office space like a year ago, it was our last resort. We're like, well, we'll try this Kiln, but I think it's too expensive for what we're looking for. But had no idea everything that it offers. So they happen to be expanding in all the states that we're moving to. They can scale with our business. So we started in a tiny little office, and now we've got a larger office with a view, which is amazing. But we're able to host our nurses all over the states in Kiln buildings because they're all over, just like we are. So Kiln has been a diamond in the rough for sure.
Fantastic. What states are you in right now?
So we're in Utah, Idaho, California, Arizona, Washington, Montana, Texas, and we're moving into Nevada and Wyoming right now.
That's amazing.
Yeah.
Maybe we need to, when we're in Idaho and California, if you're in those Kiln buildings, maybe we'll stop by and say hi.
Yeah, you should. We're definitely in the Boise Kiln building. Yeah.
Cool.
Stop by and say hi, and especially on a road trip, grab an IV.
Yeah,
that's true.
You know,
we are shattered right now.
Let's do it. We'll do it. Yeah,
yes.
We'll be there later on this week.
Oh yeah, do. And if you have time today, you can stop by my office for a B12 MIC shot. If you like injections, which
Wait, what?
I don't know. I haven't really come across a man who likes injections, but
I'll accept one.
yes, when you feel the difference, you're like, okay, your mind and your body, you're just like, this is what I'm supposed to feel like. This is amazing.
Let's try to do that before we leave, although it's really tight today. We might have to be...
Are you here all day?
Yeah, we'll be here all day. If not, I mean, like you said, you're going to Idaho. Mm-hmm. You can call one of our nurses. I've got some information for you. Thank you. But we're all along the way, so...
I think we should definitely try it.
Yeah.
We'll find a way to try it. If not today, it'll be in Idaho, but we'll try to make it work.
Yeah.
So, what's our last few questions?
Yeah.
Maybe the challenge and status quo, or
I mean, you mentioned it already that you feel like, I mean, and we can tell from your story that you're definitely challenging the status quo. You're creating something new. One thing that we ask, everybody that comes in here is, what does it take to take an idea and to create a movement or challenge the status quo? Like, we like to get everybody's perspectives on that, and I'd love to know what you think.
I think it takes passion, commitment, dedication, and persistence. I mean, it is no easy task. And like us, we're not just up against other IV companies. We're up against insurance companies and pharmaceutical companies. And that is no small task. So we just have to keep persistence. We just have to keep going, until we see a change. We've got to be the change.
Yeah, I love it.
Yeah, that's great.
Josilyn, thank you so much for being on the podcast.
We
really appreciate it.
Thanks for having me.
Any last things you wanted to talk about or share? Or how people get in contact with you? Yeah,
go to Modwella, MODWELLA.com, and you can see if there's a nurse in your area. Call her, text her. She would love to come to your home and leave you feeling better than she found you.
Thanks for tuning in to today's episode of the Kiln Road Trip. Be sure to follow along on the rest of the journey, and you can do that in two ways. One, subscribe to the podcast, whether you're listening on Apple, Spotify, or maybe even watching on YouTube, and follow along on all of our social media platforms, whether you're on LinkedIn, Instagram, Facebook, Twitter, or TikTok, @the Swell Pod. Thanks again, and we'll see you in the next episode.